Hi, am I audible? Hello everyone. Am I audible to you guys? I'm not audible. Can you hear me? Is my voice clear? Hello, Dr. Ankita.
Hello, good evening.
Good evening.
How
So
are you?
everyone, yeah, I'm fine. Everybody, this is Dr. Ankita. She's a psychiatrist and a mental health expert, as well as a life and wellness coach. She'll be telling us all about mental health and periods today. So yeah, let's begin with the IG live.
Hi, first of all, I would like to thank the entire team of Avaika Health for inviting me and giving me this opportunity to share this platform with you guys and such a beautiful, beautiful audience. Everyone, a big hi from my side. And first of all, I would like to say and tell this and emphasize on it that a big shout out to all the women that you endure so much and you don't even demand extra attention, extra need, and you don't even shy away from your responsibilities and you continue to do it because in India we are not that privileged to get even paid leaves, right?
Yeah,
So
absolutely.
yes, so the entire women community, you should take pride in it and say that yes, we are super women and we continue to do whatever we are entitled to do, and we do not, we are not boggled down by any of these problems that we go through. So yes, so this is a big thing, and we all of us must take pride in it.
Absolutely. And for Sophia, who's asking about that she can ask questions, absolutely. You can pin down all your questions in the comment section below. We'll be also having a live question and answer session at the very end of the IG live. So stay tuned, stick till the end, and clear all your queries.
So can
Over
we
to you,
begin
Dr.
with the
Ankita.
topic?
Yes, absolutely.
So as we all have seen, the flyer says that your periods and mental health. Okay, so it's quite a broad umbrella. Okay, it's your periods and mental health means it can go both ways. First, either how the impact of periods can have on your mental health, and another way around is how the impact of mental health can have on your periods. So I would first like to focus upon the impact of periods on your mental health. All right.
Sure.
So you see, during our periods, if I personally categorize it, I'll face that most of us have, most of the women, we have these three phases. Like what happens
Yes.
before our periods, what happens during our periods, and what can happen after our periods.
Yes.
If we see that most of us, around 80% of the women, somewhere or the other, they do have some mood fluctuations that occur during our menstruation. So, which is taken
Absolutely.
as to be normal. Okay, most
Yeah.
of us have this because of the hormonal fluctuations that are going on, that we are going under. So, that can have some effects on our mood. But most of us, what we talk about is PMS or PMDD. So PMS is what? That is premenstrual syndrome. And PMDD, I'll talk about that later and how it is different from PMS.
Yeah.
Okay, and so what happens before our periods? Okay, before our periods, we are mainly entitled to mood fluctuations. Okay, that is the most common thing. So in that, we can have irritability, we can have, a crankiness, what people usually say. Then apart from that, we can have unbound, no reason at all, but we can have crying spells for no apparent
I
reason.
cry a lot personally for no reason.
So correct. So you don't know what is the reason behind it, but I can tell you the reason. Sole reason is your hormonal fluctuation, nothing else. Okay, so then you'll have crankiness, you have irritability, you have these, unnecessary weeping or crying spells. Apart from that, what you get is you always feel you're at at the edge. Always you're feeling some edginess, some jitteriness that is there
Yeah,
because of any apparent
absolutely.
reason. Even if you're stressed, even if you're not stressed, there is no particular reason as such, but you will always feel that there is some amount of problem that is going on. So
Yeah.
that at edge problem is definitely there. So these are certain mood symptoms that are very prominent before our periods. Okay, and once our period begins, apart from these mood symptoms, there are also some physical problems that come. We all might have experienced that there is some amount of bloating sensation that is present. Then we
Truly.
have some amount of weight gain. If you, it becomes quite apparent, people say that, ma'am, we have gained 1 kg of weight during our menstruation, and then suddenly it goes away after the
Yeah.
periods end. So that weight gain is also because of hormonal fluctuation. Then
And there's
apart from
nothing
that,
to like really
there's
worry
nothing to
about the
worry
weight
about.
gain.
Correct. It is eventually, that is nothing but just the water retention that is going on. So
Yeah.
you might see that you become little, puffy during that period. So that is also there, one of the reasons. And apart from that, you will have breast tenderness, which is also present during that
Yes.
point of time. Some women get it. Needless to say, many women get the severe pains, abdominal cramps, which are there. We call it as dysmenorrhea. That is also one of the main
Yeah.
reasons what these women complain of. And then apart from that, what you also get during these time is the cravings. Very irrational cravings you will get during this period. You like to have more of chocolates. You like to have more of
Yes.
sweets. Some women have
I
this
think
particular,
everybody can
yeah,
relate.
some women can have these particular cravings that, no, I want to have that many golgappas only, or I want to eat this particular chocolate only. So that can also
Yes.
happen. It's nothing, just your hormones calling you, nothing else. Okay, so that is just your
Absolutely.
hormonal call. So be very normal, okay with it. And then what happens after your period subside? Okay, after your period subside, you will notice that these all symptoms, they will take time, at least 4-5 days, to eventually wane away. It will not going to go just immediately that they came and they suddenly went off. It's not like that. It takes around 3 to 4 days for your hormonal levels to come back to the normal, and then these symptoms gradually disappear. So these
Yeah.
are certain problems that we face during our menstruation. Now what happens? From these symptoms only arise premenstrual syndrome. Whatever symptoms I have told you, they are just, a very milder version, which all of us, as I said, 80% of women experience. But from those 80%, there are around 18 to 20% women who progress to a little more moderate to severe version of these symptoms, which we commonly call as premenstrual syndrome. That is
Yeah.
PMS. And people make a lot of memes and jokes about, oh, she's PMSing and all that. So that
Yeah.
need not be done. Not everyone is PMSing. Only 17% of the women do PMS. Okay, so that also needs to be taken into consideration.
Yes.
So these 17% women should be our target population, because we need to identify them, especially these women. Because what happens, only these symptoms, when they worsen, they can even land up into depression. They can even land up into anxiety disorders. They can even land up into multiple pains, bodily pains, what we call as somatic disorder. So these are nothing but just the pains in the body, which, because they are not able to express themselves, they are quite a lot, they are just trying to deprive themselves of the emotional expression. They are, controlling themselves a lot. They are not voicing out their feelings. These come out from from their system in the form of multiple pains. So that
Yeah.
should be taken into consideration, what we call as somatic disorder. So these problems can happen with people who suffer from PMS. Okay, and then what happens, from these population, from the people who are suffering from PMS, only 4% of them progress to extremely severe form, that is known as premenstrual dysphoric disorder. That is a proper mood disorder that can happen to them. So nobody can take it in a very lighter form कि ठीक है, ये normal है. Okay, 80% normal है, but from them 20% can have genuine problem, और उनमें से
Yes.
भी 4% को ऐसा हो सकता है that they severely require a mental health professional or a mental health expert. Okay,
Yeah.
so
Absolutely.
those 4% people can have severe problems. And trust me, I don't have the Indian figures with me right now, but at least 5% of the US population have reported that divorces are very common among them during this phase. because they become so hostile, they become so aggressive that they can land up with loss of job. So there will be financial insecurity to them. Apart from that, there will be emotional outbursts, irritability that can lead up to all those divorces. So again, there will be negative impact on their mental health. So these problems need to be tackled much before they advance to a severe form. So that needs to be understood by the people. Apart from that, if these symptoms, as I said, if they do not wean off 4 or 5 days after your periods, they can actually land you up into depression, the whole clinical depression. That is, you can have low mood, crying spells, loss of interest in any of the activities that you are doing. You might feel hopeless, helpless. Even suicidality are very common during that period. So, and also the people who are suffering from abdominal cramps, they are anyway so much distressed with the physical problems that they become very vulnerable for these depression, anxiety, and other form of multiple pain disorders. So one should be careful about these symptoms as well, that they should not progress to such a level that it becomes difficult for them to come back to their normal pace.
Absolutely. That
So
needs
one
to be
should
taken
be,
care of.
yes, one should be very, very much careful. And the best way is to understand your own cycle first. How frequently this is happening to you. You can actually have a calendar track for this, that how frequently you are expressing those emotions, how frequently you are not being able to go back to your regular cycle during your periods and after your periods. These tracking should be done, so that you can take help at the right time from the right person. Because usually we land up with gynecologists and they say, okay, ye to normal hai, and this can happen to anyone. But so these problems, the mental problems, they sometimes go unnoticed and they only come up once they have progressed to a severe level, which should not be the case, especially in Indian population. Because we are not at leisure of getting so many holidays, so many paid leaves, and still mental health problem is a big taboo and a big stigma in our society. So nobody would like
nobody,
to, yes, nobody would like to
nobody
go
really
and
thinks
open
about.
up. Correct. So opening up to these problems is not very common, especially in India. So one must be very wary about all these things. One must be careful about these things, and one must be open about these things most probably. So that's when the whole problems can be tackled. And apart from that, so this was the whole journey of how it happens before, during, and after our periods. So this was the part where I told about how the impact of periods, what is the impact of period on our mental health. The second part is how the impact of mental health can happen on our periods. So if a person is already suffering from depression, if a person is already suffering from anxiety, if a person is already suffering from any form of mental disorder, that could be somatoform disorder, that is somatic disorder, or any form of schizophrenia, or any form of mania, mood disorder, ADHD. But ADHD often comes with some part with depression and anxiety already. So again, it goes back to the same cycle. So anyone who's suffering from any form of mental disorder, any form of mental health problem, even a minor stress, or a what we call at burnout, that thing, all these symptoms, all these problems, they have a combined effect on our mental health also, and they have a combined effect on our physical health also. So if we talk about physical health, I think most of us know that getting delayed periods are very common in these people. They can have delayed periods, they can have periods for a very few days, like only for 1 or 2 days they'll get their periods. Or
very irregular cycle pattern.
Correct. So the irregular patterns will be there, what we call as irregular cycles. Then what happens, even sometimes the stress is so much that their cycles can get repeated within 20 days. We call it as polymenorrhea. That is, within a span of 2 or 3 months, you'll get your 4 cycles. So that means your, the repetition of the cycles increase also. So these are some problems that can happen with these are the impact of mental health on your problems. So these already you are enduring so much with the mental health issues, and they get added on by your physical problems also. So invariably there's a vicious cycle. Again, the problems which increase from physical health, that is going to have profound impact on your mental health also. So ultimately you are going downhill. पहले मेंटल हेल्थ प्रॉब्लम था, फिर उसके वजह से आपका पीरियड्स डिले हो गया या ज्यादा हो गया, और उस वजह से आप और परेशान हो गए, एंड देन यू हैव योर द मेंटल हेल्थ प्रॉब्लम्स इज लाइक अ स्नोबॉल फिनोमेना, और बढ़ता चला गया और बढ़ता चला गया. So that problem also needs to be understood, and that also needs to be accepted here, that solely
Exactly.
and solely your mental health problem cannot be just mental health. It can also increase to your physical health problems. So that should be understood very
It's
well.
all intertwined. People need to
Correct.
understand that.
Yes, definitely. People need to understand that. People need to inculcate it in their regular practice. The what we call it as assessments, physical assessment, mental health assessment. These assessments are very basic thing. They need not be taught to anyone. You should be able to voice out what you're feeling, so that you understand what is going on inside your head, what is going on inside your body. So you can
Yeah.
understand and relate them very well. That where the problem is actually occurring.
Absolutely. So, like in the initial days, nobody ever told us about the PMS thing, right?
Correct.
And we weren't really aware about the situation and what mood swings were. And slowly and gradually, we understood by the means of internet only that, okay, there's something known as PMS, then there's something known as mood swings, cravings as well. So, you
Correct.
need to find it like, according to yourself, what you are experiencing, what you're going through. That's really necessary. So if you won't look out for yourself, for your mental health, nobody will actually do it for
Absolutely.
you. So
Absolutely.
like girls need to know that. Sisters, like look out for yourself, honestly, and take care of your mental health as well.
Correct, correct. Definitely, definitely. So, these are just, physical and mental health symptoms that we talk about. But nobody talks about, what social impact can also have on you when you are already suffering through so much. You know,
Yeah.
uh, Especially when, today's time when all the women are going out working so much,
Hmm.
they have a lot of problems. We are not benefited with so many leaves or anything of that sort. Okay, you're not given any special attention during those periods. You can't even voice it out that you have these problems. Okay, even if you voice it out, people are going to take it in a negative way, that okay, now she'll have this bahana and then she'll try to escape out from the work. But that is not so. Okay, we
Yeah, and they
genuinely
think
need
that
some
like
extra time. Yes, we
yeah,
genuinely need
they
some
think
some help is required during
hmm.
that time. So
And when you
but
tell them like you're going through like period cramps, they always tell you, अब तो इतने सालों से हो रहा
अब
है
तो
तो
इतने
आदत
सालों
होगी
से हो रहा है. Correct, correct.
you
So
can
it's
bear it,
it's
but it's not that way.
absolutely true, but it's just not normal thing, right? For them it has become normal, but for us we are still alien to this continuous feeling that goes on during that time.
Yeah.
Because okay, it's not happening for 30 days, it is not happening for 365 days a month, 365 days a year. It is just happening for 5 days of the month, and which we are also not very attuned to. So when it starts happening to us, even we are not very comfortable with the whole system. So but the thing is, what I wanted to say here is a lot of social phenomena in the form of social insecurities, as what people will say if they see the stain on my clothes, what people will say if I ask for a sanitary napkin from them, what even in India, especially when a lot of women are working, so they will understand this part, that though sanitation is still a big problem here, we are not very comfortable in
Totally.
using public washrooms and going there because of fear of contracting infections and what so not. Some of them are not even provided with water, and there are a lot of issues that are going around. Okay, so then that point of time, there are a lot of taboos and myths that keep on circulating around these things, like okay, you should not be during this period you should take extra care of yourself, you should not mingle
Hmm.
much with the people, which has nothing, basically nothing to do with your periods or anything for that matter. But these are just the social taboos that keep on prevailing during this period of time, and nobody understand it, but yes, they also have profound impact on our mental health. What are you doing? You are basically cutting that women from the society for that particular period of time. So
Yeah.
which is not something very healthy, because you're asking them to restrict your certain favorite diets during that period because it's probably hot food or cold food, don't know what other
Sour
reasons.
food, especially.
Correct. Khatta mat khao, garam mat khao, zyada. So many things can happen to you. Nothing can happen to you. basically. It's just about what you want to eat during that period. You don't
And
have
I
to.
hope, like, I'm sure that you must have heard this myth as well, that in some of the families, women are told not to enter the kitchen, especially
Yes,
when
yes,
they're on their
because
period.
हाँ क्योंकि खाना सड़ जाएगा. I still don't know how खाना
Exactly.
सड़ जाएगा. I have no clue about that.
Same.
I have no clue. Are you passing some germs that the food is going to get stale? I have no clue about that. What the whole logic behind this concept is here. So these are just the myth. But what I wanted to emphasize upon is these myths. They keep on emphasizing the mental trauma that the women is already suffering so much, and then because of all these social stigma and social taboo, you are basically hitting a nail on that, the you can say on that wound, you are
Totally.
basically hitting the nail on it. So these things can also lead to a lot of mental health problems, especially in not so in urban area, but in rural areas. Many of the children, especially the girls of the adolescent age group, they still face these problems. They still have these, they have to endure these social stigma, social taboos, and especially when they are in an age group where they are still developing their whole mental health and the whole
Their
physical
self-esteem,
yes, not just the
self-confidence.
physical, not just the self-esteem, the holistic way they are developing
Yeah.
right now, and the whole developmental phase is dependent upon your social setting, your social surrounding, what you are given in that part. So basically I feel that a lot of women from the rural area must be suffering through these problems, and even in some urban setting also, a lot of families still harbor these culture. So we need to think about them once again. We need to rephrase the whole cultural system here. We need to understand this part also, that you are basically making the women suffer more by putting these things on them. So that needs
Yeah.
to be also inculcated. Along with that, we have to think about their social security, that because of a lot of problems that they face, there's loss of job, because sometimes they are not in a state to work as much as they are, especially for women who bleed a lot, who have heavy flow during their menstruation. I think almost people who have heavy flow, they can relate that on the second and third day they are not in a state to work as much as they are capable of doing previously. So during that phase, there are a lot of loss of jobs, loss of workplace attendance. So that also leads to the loss of financial security to them, and that can also have a profound impact on their mental health, because ultimately that is going to add on to the stress that goes on, and then it fires back to you somewhere or the other.
Absolutely. So Preeti is asking about touching the pickle myth, and we are aware about this myth. We've been told, and Preeti, there's nothing to worry about the pickles and the periods. I think there is no certain connection between both of these things, and you can easily have or touch your pickles, right, Dr.
There's
Ankita?
only one connection, that is P, the first letter, the pickle and period. That's all, no other connection. So you can enjoy that
Absolutely.
connection if you want to, and eat as much as you want. No restriction. Of course, not to an extent that
Totally.
it harms you physically. Only that thing, nothing else.
Yeah, so you can have your pickle in peace.
Yes. Any other questions which are pouring in?
Yeah, so let me check. So they are mostly about like blood clotting as well as irregular cycles, delay, especially. So I've gotten a lot of queries, Dr. Ankita, about teenage girls asking me that their cycles are irregular and they are very stressed about it. Right, so
Mm-hmm.
they've gotten their period for a month, and then after 2 months, there's a gap and all of that, and they're very stressed about it. So, can you reflect on the part where stress actually affects our period and how it relates to that?
Definitely. As I said, see, everything is related to your hormones. Even the mental health problems are related to your hormones, and the delay in periods are also related to your hormones. So, what we are talking about here is the entire hormonal fluctuation that keeps on happening. So, of course, stress, depression, severe burnout, these are some of the reasons. Excessive physical exercise also. Excessive physical exercise, strenuous activity, you have your exams, you have an interview, you are just about to get married also. So these are some of the social stresses that
Hmm.
keep on haunting us at some of the other period of time in our whole lifetime. So if we don't have to worry about it, the best way to understand it, this is, it's all right if your periods get delayed for once or twice. What medically, what we ask patient is to track their periods for 6 months period. If continuously it is happening every alternate month, or for 2 or 3 months altogether, then there is certainly some problem, certain issue that needs to be encountered with, that needs to be calculated upon, that needs to be taken care of. So at least for 6 months you have to understand that you have to track your periods. Why 6 months? I'll tell you. Because any form of stress, any form of anxiety, any form of lifestyle modification that you are harboring right now, they cannot hamper your system for continuously for more than 6 months. Even if you have a depression, the natural cycle of depression, if you have already diagnosed with and you are taking treatment, within 6 months it will go away. So 6 months is the time when you have to give it for your periods, to come back to your normal cycle, to come back to your normal hormonal level. Because any hormonal fluctuation, if you are pregnant, except if you are pregnant, any hormonal fluctuation can come back automatically, can be reset, can be adjusted to, your body gets adjusted to it in the period of 6 months. So you have to give at least 6 months of time for your body to get adjusted with. So even if it's a physical problem, if it's a mental problem, everything, your hormonal levels automatically adjust according to your existing condition.
Yeah, totally. So here, a user named Seven Coffee Shots is talking about that in some places they don't even let her step into a garden क्योंकि फूल मुरझा जाएंगे.
Yeah,
Now,
I have heard about that.
I like this. This was my first time I'm hearing about this, and my goodness, the way Indian society targets onto the self-esteem of women is astonishing. I mean,
You should be
फूल
more
मुरझा
happier
जाएंगे,
that
ये हो
despite
जाएगा.
of enduring so much, we are still standing tall. We are still facing everything with our heads and necks up. Everything we are doing,
Exactly.
and we are not boggled down. So cheers to us for that we are doing a good job here. But yes, you should take care of yourself. You should be known about these myths. You should understand them, that these are just myths, and don't fall prey to them. Don't harm your health. So basically, if your society is not standing up for you, don't worry, you stand up for yourself. That's the whole thing that
Truly.
you do here.
Absolutely. So, doctor, I personally wanted to ask this question. What about the cravings I have while I'm on my period?
It's okay. See, cravings are natural, but natural. In our medical fraternity, we call these periods as mini pregnancies. Okay, they have all the sweets
I
and
agree with that.
everything related to what usually females endure during their pregnancy phase. So the pains, the abdominal cramps, we refer to as कि ये तो छोटा मोटा labor pain है, इसका ये तो just इसका trailer है. So everything, you can understand how much pain they have to endure during the labor phase, then when they are delivering the baby. So these things, they are very normal, okay. But the thing is, if you are having too much of craving, you have to think on those terms that eventually it is going to lead to weight gain. And already during your periods, you are having at least 1 to 2 kg of weight fluctuation. So what needs to be tackled here is, and what needs to be focused here is, how to endure the craving part. So here, I would say that give in to your cravings in a restricted way. Okay, so that is the only thing that you can do. Don't stop yourself, because yes, you need to be cherished during this period of time, and if nobody else is doing it, do it for yourself. That's okay.
Yeah.
But
Girls,
only
go on
thing is,
Zomato, order anything you want.
correct, you can order, but in a restricted way. Like, okay, if you have 4 days ka period or 5 days ka, 1 or 2 days okay. Agar 5 days, 2 days okay. 4 days, 1 day, perfect, no problem in that. But don't go beyond it. Okay, that is the only thing. Because then ultimately it is going to land you up in a lot of weight gain, and this weight gain, that 1 or 2 kg, you can shed easily after your periods get over. But
And it
this
automatically goes away
yeah,
with
it
that water
automatically
retention.
goes away. Yeah, nothing needs to be done. Yes, what we usually suggest how to cope up during this period is eat lot of complex carbohydrate. What is that? Eat lot of whole grain wheat, whole legumes. You can eat a lot of pulses. You can eat good intake of protein, eggs, increase calcium that you can have in your food, and restrict salt. ऐसा chips विप्स नहीं खाने का, because again that will lead to lot of salt retention, and then salt will be there in the body, then water retention will happen, and then eventually you'll have your weight gain. So this will also add on to your weight gain part. So take frequent meals, take small quantity, multiple times a day. So this will help you in craving also. What happens with your stomach full, you won't have the craving, but with your stomach empty, you will definitely get the craving. So for that you have to, you know, keep your tummy full, but not so full, because bloating is also very common during this phase. So have small meals, have frequent meals, have nutritious meals, so that will keep you full, that will help you in shedding the weight also easily, that will help you in restricting weight gain also. So that is the thing. Apart from that, keep on doing lightweight exercise. You know, if you are going for a walk, please go for a walk. Don't restrict yourself from going from walk. You can do, simple aerobic exercises, you know, not heavy ones, just a simple aerobic ones. You can do meditation. Take proper amount of sleep, because that is very essential during that period of time. At least 8 to 9 hours of sleep is mandatory. And then avoid alcohol, avoid caffeine during this phase, because again, these are nothing but just, you know, retention of water, nothing else. So that is also going to harm you back. And alcohol is anyway not good, especially during your period phase, because it increases your pain threshold, you know, so you are going to feel a lot of cramps eventually later. And plus it, you know, completely dries your body of water, so there will be a lot of
the dehydration.
again, lot of dehydration will be there. So, and especially during this phase, if you keep on consuming a lot of water, that is going to, you know, flush your system off from all the toxins that can accumulate. So these are very good, some of the tips that you should and you must follow during this particular time. Apart from that, you need to combat your stress also during this phase, because stress again is going to have, you know, going to fire back you in a way that your mental health problems can increase during this phase. You can also have a lot of anxiety, a lot of jitteriness that can worsen during this phase. So you have to keep your stress level low. You can do yoga, you can do meditation, that can help you. And apart from that, you should also know when to see a doctor. That is also very important. A lot of people don't understand this, and when should we go and see a doctor. So here we should understand that if you are having severe pain, severe abdominal discomfort, severe dysmenorrhea you are having, you must consult a physician, you must consult your doctor, you must consult your gynecologist. Another is excessive weight gain. You know, normal 1 to 2 kg weight gain is okay, but if you're gaining 3, 4, 5 kgs during this particular period, and then you are not able to shed it down, so there is definitely something wrong. So you must consult your gynecologist. Another thing is severe mood symptoms. ऐसा नहीं है कि थोड़ा सा गुस्सा आया, थोड़ा सा crankiness है, so then you are okay. But अगर बहुत ज़्यादा mood fluctuation है, या like you are continuously crying for more than a week, you are continuously anxious for more than a week, then you must definitely see a psychiatrist, because you are in need. You might have some mental health problem here. You can actually, you know, switch side and go to severe depression also. From just PMS domain, you can actually jump onto depression very easily. So you must know when to consult your doctor. If you're feeling suicidal during this period of time, definitely you need to go to a psychiatrist, because these symptoms are not normal, but they do occur to some of the women. And another one is irregular menses. Of course, irregular menses, as I have said, if it's more than 6 months, please consult your gynecologist. You definitely need to.
Totally. So one more thing about periods is that we get a lot of acne, and somebody in the comment section was talking about acne. I personally get a lot of breakout during or around my cycle, right?
Correct.
And sometimes it also lowers down the confidence of a person and seriously targets on your self-esteem. You're already going through a lot of hormonal changes, fluctuations, mood swings, jitteriness. On top of that, you have this like acne thing, right? So like, how can we tackle that? A lot of I'm sure a lot of people go through this problem.
Definitely. See, here also, why acne? Again, the same concept, hormonal imbalance. You know, our hormones basically affect our sebum production, what we get on our faces. This is nothing but the, you know, a lot of sebum and sweat, if they get mixed together, that is when we get the breakout. If you have noticed, usually your skin texture becomes oilier during the time of your periods. Why
Yeah.
is that happening? Yes, that is happening because of, again, your hormonal
Excess
fluctuations
sebum
that is, yes,
production.
that is going on during that particular time. And if you do not keep your clean, you keep your face clean during that time, and if you are using certain amount of products, or especially the makeup. I've seen a lot of women, they say that ऐसे तो कभी breakout नहीं होता है, during periods if I put makeup सारा face खराब हो जाता है. Yes, that is because of the excessive sebum production that is happening during that particular time. And these, when they get mixed with the cosmetics, they can cause such problems.
Yeah,
So
totally.
you don't have to worry about this, because the hormonal fluctuation is just transient. Eventually, once your periods get over, after 4-5 days, they are going to come down, and the hormones level are going to get balanced. They are going to be as normal as they were before your periods, and eventually these productions are going to stop. So what you have to do here is, that's why I keep on saying, hydrate yourself, because that is going to keep your the inner glow, and the toxins, they can get removed from your body. Another thing is, as I said, those sweet meals that you are taking right now, especially the chocolates, all those oily food,
Yes.
all these things, they add on to the building of toxins in your body, and which come out in the form of these acne productions also, because they also have impact on the sebum production in our body. So that needs to be taken care of. Yes, the problem here is, once the period goes away, after that, if the acne persists till the next cycle, then that becomes a problem, because that is your independent acne production. So
Yeah.
that needs to be taken care of by the dermatologist. If you want to seek help, please go and seek help for that, because usually the acne which come immediately before menses or before your periods, they go away within 1 week or 10 days. But those which continue, they keep on occurring till your next cycle, because till your next cycle is your normal, is the problematic acne production that is happening right now. And once it goes, it coincides with your periods, and that is your hormonal acne that is coming up there. So that becomes a vicious cycle for few people. So for that, they can take treatment from the dermatologist, especially if your acne is persisting after a week of your periods getting over.
Yeah, but a lot of people also connect acne with their self-worth. So like already they are having a lot of mood swings, and then they start feeling super low because they're having acne. They think that they do not look really good, and with all those mood swings, it's a very combined, strong recipe for anybody to let their confidence down.
Yes, I do agree with that. A lot of our physical appearance has to do with our self worth and self confidence. I always say that it's all right. Okay, it's all right, even if you're not the prettiest faced in the mirror, but you should understand from within that it's okay. I am worth I am. Okay, you don't need anyone to make you feel that okay,
Exactly.
you are the prettiest person. I think most of us have heard about the Miss Universe interview recently that was given by
Yes,
Harnath Sandhu. And what was her winning question? Like
it
about the
was our
self-worth
all
itself. About
self-perception.
the
Yes.
self-worth itself. That, okay, you do not need someone else to remind you that you are worth something. Just believe in yourself. It's okay. It's all right. These things are going to be there only for a particular period of time. They are not going to govern who you are as a person. So that's okay. And yes, that's why I recommended seeing dermatologist if it is too much of a problem, because uh, uh, I'm not saying that okay, only glorifying yourself from within can help you in this situation. No, only glorifying from within helps you in certain situation when you have faith on yourself. Okay, when you know that you can endure it. But if for a person who is already quite a lot boggled down, it doesn't help that way. Okay, it's just like you are giving false preaching to them. So I won't believe in that. So if it's really problematic for you, if it is really causing you a loss of self-esteem, loss of self-worth, then you must seek treatment. I am not going to shy away from saying it. You must seek treatment, because invariably it is going to affect you in a longer run. Your self-esteem, your self-confidence, as the time progresses, it is going to boggle down. Okay,
Yeah,
so
totally.
if you need that, no, it is the time when I must work on myself, I need to get treatment for it, then go ahead. It's all right to give it a shot. But there are certain situations also where the treatments don't work completely. So that is the time you have to understand that for everything there is no treatment. So
Yeah,
you have to inculcate some confidence from within you as well. So
totally.
there is a very famous quote that she remembered who she was and the game
And she
changed.
changed, and she
So
changed
yeah.
the game.
So
Yes.
you have to remember this thing, that it's all right. It's okay the way you are.
I think it's totally true. Women like need to believe in themselves more. We are taught from a very young age that we need to take care of people around us, but nobody ever told that it starts with yourself. You need to take care of yourself first. Then you can take care of everybody which is like around you. So that's very
Correct.
important.
See, you should always remember self-care isn't selfish. Okay, so there is a difference
Totally.
between self-care and being selfish. So what we are
Yeah,
talking about here is self-care. We're not talking about being selfish. So just believe in
absolutely.
yourself for that. And I think you're very good to go. Even if the society, as I said, even if the society doesn't support you, it's okay. It's all right. I am there, and I am there for myself, and I believe in myself, and I stand up for myself. That's all. You don't need everyone every
Absolutely.
time. You don't need people to support you, because at some point of the time in your life you will not find anyone apart from yourself standing up for you. So you must believe in yourself for that matter.
Totally. So, do we have any more queries or questions? So, if you have, like, you can pin down in the comment section. Okay. Are blood clots normal during a period?
Yes, they are normal. At least in the first 2 days, yes, they are absolutely normal. But yes, if you are continuously getting blood clots for the whole 3, 4, 5 days, then definitely you should seek consultation. And apart from that, if the blood clots are associated with heavy flow, then definitely you should consult your gynecologist, because they are oftenly related with there are some cysts or fibroids which are usually there, and those patients usually get some sort of symptoms. But don't worry if it's only restricted for 1 or 2 days or first 2 days of your menses. That's absolutely normal.
Yeah. Then Preeti asks that is there any problem to wash our hair during periods? A lot of people say that we shouldn't wash our hair. It is a myth or what?
It's
I think
absolutely a
it's,
myth.
yeah,
It's absolutely a myth. Nothing to do
absolutely.
with hair wash. Rather, you should wash your hair, because as recently this question was asked about, the acne. The same
Hmm.
sebum is produced in the hair also, and there are a lot of oil deposits that can happen during that period of time.
It can make your
Because
skin and scalp go really
yes,
greasy.
it becomes very oily. Excessive sebum production will be there, and that makes your hair more prone for infections. You can have dandruff, what we usually call. And there are other problems like itchiness and flaky scalps. They're very common when you
Hmm.
have accumulation of sebum. So please wash your hair. There's nothing to do with it. Again, the myth.
Yeah. Take good hot showers and wash
Correct.
your hair. Take care of yourself.
Take care of
Yes,
yourself.
it's necessary. Any other queries we have here? Yeah. So a lot of people still joining in, I can see.
Okay.
So any other thing, Dr. Ankita, which you want to enlighten us on, specifically regarding mental health and periods, or something
See,
related to the
yeah,
situation
of
here?
course, why not? The thing is, see, related to periods and mental health, as I said, it's a very broad umbrella. A lot of things come under
Hmm.
this. A lot of people, don't understand this part, that even if you are not suffering, somewhere or the other, you are suffering. And that acknowledgement is quite necessary for,
Hmm.
these women. And the main thing is that we don't talk about period poverty in India, which I really want to
Yeah.
highlight here. That still, a few years back, there was a lot of chaos regarding, the cost of sanitary napkins that was highlighted, because, other things were given a lot of subsidy, but sanitary napkins were not given
Yeah.
that much of subsidy. So that is what we call as period poverty. That is, many women are not provided with the sanitary napkins in India. However, if you go abroad, almost everywhere, there will be dispensers where there will be the sanitary napkins are available even in public toilets. But here in India,
Hmm.
it's not available, especially for rural women. It becomes quite a big problem that they are not provided with sanitation, they are not provided with sanitary napkins, they do not understand how to dispose these things in a proper way, how to utilize these things, they are not taught anything regarding it. So there's a specific term known as period poverty for them, that they are deprived of the basic necessity that a woman requires in her life. And still many of them use old cloth. They make a pad out of it. They layer it up and they use it, which is strictly unhygienic and really unhealthy for them, and they can pose a lot of problems. Recently, thanks to the Bollywood, our very own Akshay Kumar made a movie out of it, that is Pad Man, which highlighted the issue a lot on how women are suffering regarding this. So yes, this is one of the other thing, and it has a lot of mental health issues related to it, because these women, they do suffer a lot because of unhygienic problems, unhygienic state, and a lot of them have miscarriages. A lot of them can even get uterine cancer because of this. So yes, definitely it's an alarming thing. It's a cause to be raised voice for. So
yeah. So here, there's another question by Ravi Bhavani. She's asking, how can we reduce scars which comes by itching on legs while pregnancy? So,
how can we reduce scars?
Scars, yeah, which comes by itching on legs while pregnancy. She's probably talking about the red stretch marks.
Got it. It's basically, see what happens during pregnancy. There's a lot of stretching of the skin. And plus the skin becomes very dehydrated during that time because there's a lot of stretch. So two things here are very necessary. First is adequate hydration. I keep on saying that hydration is a natural remedy that you can use during that particular period. So you should have adequate plenty of fluid. That need not be just water. You can have coconut water, you can have juice, whatever you feel like. If you're not able to take so much quantity of water, you can take a lot of other fluids also. Apart from that, keep the area nourished, keep the area hydrated by applying. I'm not going to say any super fancy brand of cream, because I do not promote that. The thing is, if you can just apply basic coconut oil which is available in your kitchen, in your house, that is going to be enough. Because nobody understands and nobody appreciates. Nobody appreciates the basic thing that we already have. And people go around, buying some cosmetics, some, expensive creams that, they are marketed in because of, pregnancy scars, these things. That no, I don't go for that. And I would really recommend you to just go for, adequate hydration and use a good amount of this coconut oil. Or if you are from northern part of India, there a lot of people use sarson ka tel, that is mustard oil.
Mustard
that is
oil,
also, that is also quite familiar and quite famous there. So you can use that also. It's okay. So
you need to understand that, like,
correct.
Stretch marks occur.
That is very normal phenomena. That is just because of the stretching of the skin. If it's happening in your leg, that is probably because during pregnancy there's a lot of edema in the feet. The feet are really swollen at that point of time. Again, there will be stretching of the skin. So that is going to lead you for itching and scar production. So you can use basic home remedy, keep the area nourished, keep the area moisturized, and that you can do with normal coconut or mustard oil. That's all.
And this is just not for the pregnant ladies, but all the girls as well. We do get stretch marks when we are working out, or like when we are growing, we get stretch marks in all the stages of our lives, right? So you need to understand they occur because of the dryness and the stretching of the skin. So as soon as you see that you're getting a lot of itching and it's leading to a red or a pinkish marks, that's the starting of the cycle, right? So you can apply a good coconut oil, even Vaseline, jo hamare ghar mein normal Vaseline hoti hai. So just apply it on that area. Exactly.
And also keep the area moisturized, because if you keep the area moisturized, if you keep on applying it regularly, it is not going to extend, because the problem comes when they from red to pink they develop into white marks, and then that becomes a big problem, because they are non-removable. Don't fall into the gimmicks of surgery, this derma rolling and all those stuff. They do not work. They are just cheating you. There are big myths. They do not work. The only thing that works on a white form of scar is just the surgery, and which is very expensive, and that is also not 100% sure. Okay, it can just fade away or scar, but it doesn't go away. Okay, so that's a whole thing that needs to be taken care of. Prevention is the best cure.
Exactly, totally. So rather than itching, just put on some coconut oil and massage. That would be better.
Yes.
So a girl like a pearl, okay, nice username, is asking, I got my periods within 20 days. Should I go for a gynecologist?
No, as I said, wait. it could be a lot of other factors that have played into your part. So you need to identify, at least chart your cycles for 3 months. Okay, at least for 3 months. I usually recommend anyone to go for 6 months, and usually gynecologists also say कि at least 6 months तक आप chart करो अपने periods को कि वो कब आ रहे हैं. Problem happens if you have to count. If in 4 months, if you are getting your period 6 times, or if in 3 months you are getting your periods 4 times, then yes, you have to track your cycle evidently. And for 6 months you can track, and then still after that, if it's not hitting the reset button, then you need to go to a gynecologist. Because a lot of stress, lot of other factors, like if you are, as I said, if you are doing heavy exercise, if you are depriving yourself from nourishment, if you are on a weight loss regime, if you are doing strenuous exercise, if you are running a lot these days, you have started running recently, and you have your exams coming up, big interview, your wedding, all these things are just the social stress which play into existence, and they add on to the stress factor, and that causes your hormonal imbalance and eventually leads to irregular menses. So you need to track your cycle down for at least 6 months before asking your gynecologist or asking for consultation.
Yes. So, yeah, I think that's all for today, Dr. Ankita, right?
All right.
We've answered good number of questions.
Yes,
and
I'm glad I was able to.
And we were really happy to have you on board. We are looking forward to more IG lives with you. Thoroughly enjoyed the session, and thank you so much for answering so many queries, not only just about mental health, but about all the topics.
A lot of questions were related to periods and all those period myths, and I'm glad I remember them. I still remember them. So yes, these are some of the problems that most of us, even us as mental health professionals, a lot of women of reproductive age group, a lot of adolescent age group people come to us and they ask us regarding all these problems, and we are always happy to help. The main thing is you should know when to seek help. That's the main thing what I have always highlighted upon. You should understand when to seek help. If it's causing too much problem for you, if it's causing too much trouble for you, if you're not able to bear your pain, if you're not able to bear your emotions, if you're not able to express your emotions, that is the time you must seek help, because that is not normal at all. And it's okay to ask for help. I would always say it's okay to ask for help, because people in India, or women in India especially, they say that हम इतना कुछ सह लेते हैं, ये तो बहुत मामूली सी बात है. That's not the thing always. That's not the thing always. Because कभी-कभी आपको आपका छोटा सा प्रॉब्लम भी आपके लिए काफी बड़ा प्रॉब्लम क्रिएट कर सकता है. Because if you are not taking care of your mental health, if you're not taking care of these basic things that happen to you during your periods, this basic small attention that we need to give to our body during this phase, then you are not doing justice to your whole system also. Somewhere you are doing some injustice to your body, to your mental health, to your physical health, and that is going to fire you back someday or the other. Maybe not today, maybe not even after 4-5 years, but in the longer run, it is going to have some impact on you. Definitely it is going to have some impact on you. So especially I would like to highlight here that in India, since we have people more from the reproductive age groups, that's why we have not touched upon the perimenopausal side here. But the thing is, if you don't take care of your problems right now, once you're hitting your menopause, that time they're going to fire you back eventually. So that time you will eventually land up with either a psychiatrist or a gynecologist for some of the other unresolved issues. So the main thing is, why are you waiting to hit that phase? Why are you waiting to hit that line? Why not right now? अभी क्यों नहीं? अभी किस बात का घबराहट? अभी किस बात का डर है? So just go ahead. It's okay. आप बहुत strong हो. I get it. All the women are very strong. I admit to that. But also the thing is, the strongest of the people can also get injured, and there is no harm in asking for help that time. So go ahead. It's all right. अगर आप नहीं भी ठीक है तो हम ठीक कर देंगे. Don't worry about it. The things will be fine. So things will be fine. So don't have to worry about it.
Yes. And guys, do follow Dr. Ankita's Instagram page. She has a page completely related to mental health issues and all the things you need to know about that. I'll be sharing her page username in my story, in the Vika story right now. So do follow that. And she also gives online therapies and consultation for mental health issues as well. If you need that, consult her, please. You can book online appointments as well with her. So, yeah, you can definitely do that. And it was such a delight to have you, Dr. Ankita, here. And thank you, everybody, for joining in. It was such a nice session. Hope we'll get to do this very, very soon.
Thank you, the team, the entire team of Avaika Health for calling me once again, and thank you for asking such brilliant questions. The audience was really great, and they were
Yes.
quite enthusiastic. So yes, kudos to you guys also, and thank you once again.
Okay.
All right,
Thank
bye
you.
bye.
Bye bye.